I'm Jen.
And I'm Jen. And this is Talk Dogs with Us.
Today we're going to talk about improving care in hospital.
Okay. This episode is geared towards veterinary technicians, assistants, doctors, anybody in the kind of medical side of pet professionals.
Primarily veterinary staff.
When we're talking about patient care, what kind of patients are we talking about? Like primary care or...
I think right now we're just broadly talking about any time there is a pet in the vet hospital.
Okay. So this could apply to like primary care, emergency room, ICU. Okay. Great. All
ISO.
Right. ISO. Yeah. Forgot about the isolation.
ISO could be a whole thing on its own.
That is a whole world.
Yeah.
Something to explore. Okay.
Something for later.
Put a pin in that one. So first, let's talk about the thinking about how to think about it section.
Yeah.
So here's your example. You go on vacation and you go to a beautiful foreign country and you do not speak the language. And you're going to need medical care. You know that something is very, very wrong with you and you do not feel well. You head your way over to a building that has maybe a Red Cross kind of sign out front of it. And you think, oh, good, this is probably a hospital. You go in and you hope that they give you a translator, but instead they just grab you and they take you to a room and they hold you down and they run a bunch of tests. And eventually they do some treatments and you feel better, but you had no idea what was happening to you or what was going to happen. This example is pretty much how vet care happens to animals at the current state. And if we can think about our patients as those visitors, knowing that something's wrong with them, not knowing how to communicate what it is, not knowing how to receive information about what's going to be done with them, and not know how to anticipate treatment, we can better understand and better look at our patients through the lens of what they might be experiencing. I guess we want to talk about why we do these behavioral interventions for patients in a hospital. And to my mind, behavioral health, mental health is health. It's a part of healthcare.
Yeah.
We know that stress impacts how the body heals. Yeah. Healing on the body. And so if we can set our patients up to be, coming to the hospital, coming in for a doctor's visit, I think you're probably the only person I know that is literally excited to go see the dentist. But I don't know that going to the doctor is particularly a non-stress time. Like I don't see anybody like take a staycation and go, yeah, I'm just going to really catch up on my doctor visits. I think it's just inherently a little stressful.
Yeah.
And for animals, we don't have to go to the vet per se. Like we go to the doctor, we go to the human doctor, but not other species are showing up there, right? It's not like, well, I have to go to the doctor's office and there might be a bear. I guess maybe in a remote place that happened to somebody, but it just doesn't seem like part of the experience. So to think about being a cat and knowing that dogs are going to be there, or being a bird and
knowing that there's going to be cats around.
Yeah. Like being able to smell those cats when you get there.
You're supposed to be, your body tells you to be afraid of.
Yeah, for sure. And I think part of the thing is like, we want to, obviously we can't prevent stress for our patients all the time or our clients. But what can we do to take the edge off? What can we do to just make the clinic experience a little bit better?
The little things tend to add up.
Yeah, I think that's a great point. So let's get into it. Let's get into what kind of considerations could there be for patients in a veterinary setting.
Yeah, so when I think about things that we do to improve patient care, there is obviously the environment.
Okay.
There are sometimes medicinal things we can do.
Okay.
Handling comes to mind as a object.
Okay, so handling
topic.
as a topic. Yeah, handling as a topic. Okay. Cool. Let's talk about environment a little bit. Like, maybe how loud it is, you think?
Sounds.
Okay, sounds.
Not only coming from the staff, but also coming from other patients.
Okay, yeah. That's a good point. Cat probably doesn't want to be in a ward with a lot of dogs.
Yep, dogs barking. Dogs barking to cats, but also dogs barking to each other.
Oh, yeah, okay. Yeah, if your dog's afraid of dogs, that'd be bad news bears.
If we're talking about exotic species,
Okay.
the sounds cats make can upset them.
Yeah, a bird. I would think a bird, not to get too Tom and Jerry universe about it, but it seems like, the cat chasing the mouse, the dog coming to save the mouse because of the cat. Like, you can kind of see where there might be some interspecies issues.
Yeah. Visual
okay.
stimuli is another big thing.
Okay.
Anything we can do to decrease visual stimuli.
Yeah, because your patient with stranger danger is going to have a hard time seeing a bunch of strangers.
Not only that, but seeing other patients.
Yeah. Okay.
Dogs might be stressed by other dogs walking past their kennels.
Okay.
Cats might be stressed if they can see dogs through their kennels, through windows. We can limit visual access from not only within the cage, but also on the cage when appropriate.
Okay.
Smell is a huge thing.
That's true, because our pets do experience the world of smell kind of differently and more intensely than we do.
Much different. Like we can't even perceive.
Yeah. That fact I learned about scent maps. It takes everything in my being not to go, what would that look like as a map? And I just think about like predator vision.
I think about Donnie Darko.
Yeah, okay.
Are the smells like the thing, the movement of the thing in Donnie Darko?
Yeah.
We just have no idea.
Yeah, we have no, I don't know.
Yeah. And we're talking artificial smells, natural smells.
Right. Yeah. Things
pheromones
like blood, vomit,
from each other.
Pheromones. Yeah. Yeah. Okay. And then the other one is kind of medicinal considerations we can make, right?
Yeah.
That is including pre-meds that have been prescribed for your pet.
Yeah. I think that talking about exactly the medications is out of the scope of this podcast. But the thought of there being different medications that can help patients that are having particular symptoms. There are things where we want to consider the onset time of medications, how frequently we give those medications, and how we give those medications, because taste is important.
That's another factor.
Yeah.
Okay.
That's another, sense that patients can have. Temperature of the space.
Oh, okay. Yeah.
So
cold spaces, hot spaces.
Yep. If we have a hairless pet, then a cold exam area will be more disturbing.
Sure.
Than, say, a husky that has
and those
double
cold
coats.
steel tables, right?
Yep.
An animal has to go on a cold steel table versus a covered one.
Yeah, I actually saw a cat groomer that puts out a heater, like a space heater, on the working table for the cats.
Oh, okay.
Tactile things.
Okay.
So like you said about the steel table, but also like could we put a non-slip mat down?
Oh, okay.
Specifically.
Yeah, like where they're walking or on a scale.
Non-slip items can be hard to come across sometimes. So towels, I usually drape the towel all the way over the table and then lean on the edge of it so that the towel's not moving.
Got it. Okay. And so these are a lot of things to take in consideration, and maybe not everyone's going to have access to, not everybody can prescribe medications. Not everybody, works with a medical staff that maybe they don't have a specialist on board, or, maybe they have owners that are reluctant. But what are, I guess I want to talk about, like, what are 3 things that we think you could just try in your vet setting to just improve patient care a little bit?
Yeah, I think the biggest one that comes to mind is just assuming to cover cages.
Okay. So just provide that visual block up front.
Yeah. First step is to cover a cage. Obviously, we have to assess the patient and their symptoms, why they're there, things like that. We want to make sure that if we need to have eyes on them, we have that ability, but you could cover the top half of a cage or the bottom half of a cage.
Yeah, or even like one side versus the other.
Yep, you can
Yeah.
provide a box inside so that there's a visual barrier
Yeah.
that the pet can hide
For
behind.
a creature that likes to go in a box.
Yeah. Offering food at different times, even if the patient seems nauseous, offering it once, or things like offering food but not giving them the food because just the smell of the food can help.
Yeah. Covering medications too. If you do have a medication to administer, covering them in something more palatable can be really helpful.
Not only covering them with food, but you can also put them in the empty gel capsules
Oh,
to help
right, to cover
prevent
that
them
bitter.
the
Yeah.
bitterness and prevent them from melting in
Yeah, you
whatever
can get
you're
those empty
hiding it
gel
in.
capsules right on Amazon.
Yeah, Walmart, everywhere.
All right, so we talked about visual covers and kind of medication concerns.
Covering the taste aspect of things.
Yeah, covering the taste.
And then the social aspect of keeping the patients with their owners as much as safely possible.
Okay.
Obviously, there's going to be medical indications where a patient needs to be, have doctors or tech's eyes on them at all times. But
yeah, but
in
maybe
the cases,
only taking them away for those times.
right, and or keeping them in the room with their owners during treatments or
Yeah.
during diagnostics.
Yeah.
That's something that I have definitely seen make one of the biggest impacts, aside
Okay.
from cage coverings, is
Okay.
keeping them with
Keeping
their
them
owners as
comfortable,
much as
keeping with
possible.
Their owners, right. And then determining, do we really need to hospitalize this creature, or, what are we
Right.
doing here? And making those determinations, like, are they better served? Maybe they have significant separation anxiety, or they have significant stranger danger, and
Right.
keeping them in the hospital.
It's almost like thinking about it from a harm reduction standpoint sometimes.
Oh, yeah, that's a good point.
Yeah, sometimes
Yeah.
we're just doing harm reduction, especially if we're in the ER.
Yeah.
We are trying to do the best that we can with what we have available.
Yeah.
And that's not always going to be, the best that it could ever be. But there's little things that we can do here and there that can definitely make big impacts.
Okay. Talk Dogs With Us is an informational podcast and not a substitute for qualified medical advice.
Are you a pet professional or parent looking to learn more and challenge your current assumption about our pets? Then let's go on this journey together at our website, talkdogswithus.com. Give us a bark at Facebook and Instagram at Talk Dogs With Us. You can help keep the conversation going by subscribing to our Patreon. Art direction by Alex Oren, theme song and audio engineering by Stephen Rossblock. Check out more from him at stephenrossblock.com. Thanks for listening.